My people, I greet o, I hail una. Na me again. This one I faithfully bless TV. Abeg, if you never subscribe, make you subscribe to this channel. Press the notification bell so that if I upload any video, you go be the first person to listen, to see and to watch. And also share with your friends so that they go learn. This one I heard talk. This Dr. Abiye Hector Goma, im dey stay for Lace for United Kingdom. So im come tell us say make we dey take care of our health. As we dey pray as children of God, make we also dey take care of our health. Make God give us wisdom. Make we use im wisdom wisely. Because the Bible talk, e say my people dey perish because dem lack knowledge. Wetin dem suppose do, dem go carry am go give Baba God. Baba God do am for me. No. Wetin you go do as person, make you play your part. As you play your part, Baba God also e go do im own part. Make you no dey use your hand carry wahala. When you carry am finish, you say na Baba God na go help you. My brother, my sister, make I not talk too much. Make we lis ten to this doctor. Because im talk say a stitch in time saves legs. We know say we dey talk say a stitch in time saves nine. But im say this time around, a stitch in time saves leg. You know say this diabetes, as this doctor talk, e say e dey cause many things. E dey bring many wahala come person body. So im come talk say if we start on time dey take care of our health, all those wahala wey diabetes dey use leg and hand dey draw come body, e say we go avoid am. E say because if we no take care of our health for that initial time, initial stage, e say this diabetes e go draw yamayama with hand and leg, come pack am come all the body. Why? Because of our negligence. So me I come talk say health and lifestyle na be this talk. So me I come talk say health is wealth. Take good care of your health. My people, make I leave una, make una lis ten to this doctor. As you take care of our health, make diabetes not enter our body. And e come still say if diabetes don enter finish, e get way wey we go take manage am, make e not escalate as oyibo talk. Make e no carry yamayama again come join am. E say go get way wey we go take control am. So my people, make una lis ten. As you lis ten finish, leave your comment. Make you share am also with your friends. So make you share am with those also wey you know say maybe dem get this diabetes, so that dem go fit take control, dem go fit help themselves. Because this diabetes, e get stage 1, e get stage 2. And if e don pass that stage 2, as I talk before, e go carry e brother, e sister kidney problem. Make I not talk too much. Make I leave una, make una lis ten. We'll see again another time.
Diabetic or not. And then the fourth one is not, it is not my portion. So a lot of Christians say it is not my portion. But what if it is your portion because you are diabetic? So next slide, please. So I put SSS. SSS, it says when you want to make a presentation, S is say what you want to say. And the next S is say it, and then say you said it, which is to conclude. So I'll start by giving you a summary of what I want to say. So I want to give a bit of a background about diabetes, and then I'll tell a few life stories, maybe just one life story because of time. Then I'll talk about the risk factors of diabetes. Why is it that some people have diabetes, others don't have diabetes? And then for everybody here, particularly for the young ones, I'll talk about hidden sugar. It's really important for us to understand what hidden sugar is. There's so much sugar in everything that we eat. I'm sure it's only water that doesn't have sugar. Everything else has sugar in it. And then we'll talk about complications of diabetes. And then for those who are diabetic, or if you know somebody who is diabetic, whether here or abroad, everybody who you know who is diabetic, let them know about what good looks like. There are some things that we have access to here. Even people who are diabetic, when you ask them to come for checkup, they will do as if they're doing you a favor. And I keep saying that I cannot continue to take Panadol for somebody's headache. If you have diabetes and you don't have to pay for any treatment, it's free. If you're diabetic, everything is free in this country, medicine-wise. Even if you have hypertension or you have any other problem, because you're diabetic, all your medicines are free. I don't know who brought that kind of rule. I can understand you getting your diabetes medicine free, but if you have diarrhea, they have to give you medicine. Because you're diabetic, you don't pay for it. So as a diabetic patient, I don't wish anybody to be diabetic, but everything is free for them. But even at that, they won't come for the free health check. Well, as they say, even I think was it David who said, "I won't take anything that won't cost me anything." Maybe because it's free, they don't take it seriously. And then finally, we'll summarize and then give best advice. Next slide, please. There is a video here. I'll skip the video. It's on the presentation. So if you want to watch the video, there's a lovely 2-minute video on diabetes. So if there's time, you can play it at the end. Next slide, please. So this is more or less the story, the wheel of diabetes. So the first one at the top, 12 o'clock position, is that you don't know. When I ask the question, are you diabetic? And then you don't know your status. So that's the first one for many people. I can ask one of the young people here, are you diabetic? They probably won't know. You won't believe that there are some babies who are born with diabetes. They are diabetic. So you can be diabetic from day one, from your birth, all the way to being 100 years old. So anybody can be diabetic. Sometimes it's difficult to pick up diabetes in children because we always think of it as an older person's disease. So you don't know that you're diabetic. And the next one is the one that has a green tick on it. That is somebody who says, I know I am not diabetic. How do you know you're not diabetic? Is don't read the Bible and then the Bible says I'm in good health, so I'm not diabetic. For you to say you are not diabetic, it means you have checked your blood sugar and your blood sugar is normal, so you're not diabetic. It means as of today, because you can have normal blood tests today, in 3 months' time you can become diabetic. It's not impossible. But you've done your blood test recently and your blood test is normal. There are 2 types of blood tests. There's the one that you prick your finger and you check your blood sugar. It's called your blood, and the one that they prick and you put it and then you check it. That one, the normal is between 5 and 8. That's the normal, 5 and 8. But then if the nurse takes your blood and we send it to the hospital, that's a different test. That's called HbA1c. And the normal for HbA1c is from 20 to 41. So sometimes people get admitted and then they've checked their blood sugar at home, maybe it's 12 or 15. Then they get to hospital and they are told that their blood sugar is 100. Say, no, it can't be because I checked it at home, it was 10, or 15. How can they be 100? They don't realize that they're checking 2 different things. So the normal HbA1c, which is what we use to diagnose diabetes, is between 20 and 41. That's normal. Then, if your blood sugar is 48, that's HbA1c is 48 twice or higher, then we'll make a diagnosis of diabetes. Now, I remember one of my patients saying that, an older man, he said, when we were young, you went to see the doctor because you were sick. Now the doctor calls you and tells you you're sick. And the reason he said that was that you do a screening test, you come for a health check, and your blood sugar level, say maybe it's 49 or 50. So we'll ask you to come back and check it a second time, and it's now 50 or 51. Because it's over 48 twice, that means you're diabetic. So you now phone the patient and tell the patient, I need to see you because you now have diabetes. Say, but I feel normal. And that's why he was saying that before you go and see the doctor because you're sick, now we call you and tell you you're sick because of the numbers. So 48 and above is diabetes. And the whole idea is that before somebody had high blood pressure, it goes high, 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 and then they have a stroke. We begin to manage stroke. Or somebody has a heart attack, we begin to manage heart attack. But it's wiser, isn't it, to prevent the heart attack in the first place? It's wiser to prevent the stroke in the first place. It's wiser to prevent amputating the foot in the first place. So if nothing is done about diabetes today, in 5 years' time, you might lose your foot. So why do we have to wait for you to lose your foot to look after you? And that's why we want to catch diabetes early. Now, anybody in this country who is 40 years old or over, you are entitled to a free health check. And I'm sure there are some of you here who maybe are over 40, you've not had a health check. A health check gives us a chance to see whether you're diabetic, see whether your blood pressure is high, see whether your cholesterol is high, see whether your blood pressure is high. So that's what the health check does. Anybody who is over 40, sometimes it's a routine health check that helps us to realize that somebody is diabetic. So 48 and above is diabetic. So you have the non-diabetic at 3 o'clock position. You have pre-diabetes is that gray area between 42 and 47. Your blood sugar is not normal. You're not yet diabetic. It's called pre-diabetes. Now again, in a way to push people to the left, we now have a national diabetes prevention program. If your HbA1c is between 42 and 47, we work with you to help you to change, improve your lifestyle so that your blood sugar can go towards the left, towards normal. So even at that, some people think we're harassing them. It's like, just leave me alone. Well, we leave you alone and you become diabetic. So again, this whole idea of prevention is cheaper, is more effective. So there's a program for pre-diabetes to move people from pre-diabetes to normal. The people who are diabetic, we work with them from early on to move them from diabetes to pre-diabetes to normal. The whole idea is for us to be normal. Okay. So for those who are diabetic and their blood sugars are not too high, it's over 48, but it's not too high, then we have diet control and physical activity. Like I talked about hidden sugar. Some people will tell you with pride that I eat a lot of fruits. I eat a lot of fruit. They tell you with pride. We forget that fruits provide glucose, isn't it? Yeah. Fructose. So the more fruits you eat, the more your sugar, everything in moderation. So some people have become diabetic because they eat like 4-8 bananas a day and they think they are doing well. You know? Or some people say, oh, I can't stand water. I just drink Coke, about 5 bottles of Coke a day. So sometimes just adjusting their diet alone, taking no more than 1 or 2 pieces of fruits a day, cutting off sugary drinks. For some people, that alone reverses their diabetes. Some people are overweight, just losing weight. I mean, almost most adults who are diabetic are overweight. And when you lose weight, I mean, look at me, I may not look fat, but I'm obese. I think my body mass is 29. So if you're bigger than I am, you're obese. Obesity alone, if you reduce your weight, that alone can reverse diabetes in many people. So I don't believe in giving people medicines. If you can lose weight as a person whose blood sugar is high, you can. If you're taking 2 medicines, you probably will require 1 medicine. So and how do you reduce weight? We'll talk about that in a moment. But so for some people who are diabetic, they don't need more than diet control. And then we just check their blood sugar every 6 months, every year, and then their diabetes is controlled. But for some people, that's at 6 o'clock position. Some people, they are well controlled because they have to take tablets. And I'll tell you briefly how the tablets work. Some people are on 1 tablet, some are on 2 tablets, some are on 3 tablets. So it depends on the sugar levels. So that's the next phase. Somebody who is on tablets, and because they are taking the tablets, the blood sugar is well controlled. But if they stop taking the tablets, of course the blood sugar will go up. It's the tablets that are controlling it. Some people take tablets, the blood sugar is coming down, then they stop taking the tablets. And then they come back to you wondering why their blood sugar has gone up again. Say, but it's the tablet that was bringing it down. So if you stop the tablet, the blood sugar goes up. And then the next one is there are those who are taking tablets, but even with the tablets they are taking, the blood sugar is not well controlled. They are doing everything right, they're eating the right foods, they're doing exercise, but even with the tablets, the blood sugar is not controlled. And those are people who probably would need to be given injectables. The reason is that, again, we'll talk about that in a moment, but insulin helps to move the glucose in the food you have eaten from the blood into the cells. So let's imagine that this is the blood vessel, and there's a lot of sugar in the blood after you've eaten. And these are the cells of the body that need that sugar to break down to get the energy. So the sugar has to move from the blood vessel and go inside the cells. That movement, it is insulin that opens the door for the sugar in the blood vessel to now enter inside the cell. The cell can now use the sugar, break it down to get energy, carbon dioxide, and water. If insulin is not there, you can have all the sugar in the world in your blood vessel. But if insulin does not open the door, it's like you have the key to your house. Imagine that key, you left it in your office, but you have another bunch of keys in your hand. You can try opening your door for the rest of the night, you won't enter your house. And that's just, the house is yours, but because you don't have the key, you can't enter the house. Likewise, there's the glucose, but insulin is not there. So all the tablets are supposed to help the body to either produce more insulin or for the insulin to work. But if your body no longer is able to produce insulin, then every tablet you're taking will not work. That person probably now requires insulin to be injected to do that work. And that's why some people are taking all the tablets, but they're not working anymore. They probably require insulin. So you have those who are on insulin, who are well controlled. Again, those who are on insulin, they don't take it well. Some people take their medicine today, they won't take it tomorrow. So their blood sugar is not well controlled because they don't take it seriously. Like anything else, unless you take it seriously, there are people who have diabetes, they're like, they've not gone to school, but they are like professors of diabetes. They know their body very well. They know what to eat. They know when to take their medicines. When they come to the clinic, you just enjoy the consultation because the person knows everything about their health. And you just feel like co-pilots. I tell such patients that they are my delight because they are the boss, they are the pilot, I'm the co-pilot. They say, doctor, I've done this, I've done that. I said, you are correct, all correct, sir. And they go, other people, they won't come, you are chasing them, they come to you, it's like, why are you disturbing me? So this is more or less the wheel of diabetes. So everybody here is in one of those positions. And you don't know whether you're diabetic or you know you're not diabetic, or you're diabetic, you're well controlled, or you're diabetic, you're poorly controlled. Next slide, please. So briefly, that just shows the normal range, like I mentioned, is 20 to 41, 42 to 47 is pre-diabetes, 48 and above is diabetes. Now, if it is less than 53, if you're diabetic and your HbA1c is less than 53, it means the control is excellent. If it is less than 58, it means the control is good. If it is 75 or over, it means the control is poor. And there are some people whose blood sugars are maybe as I have a patient whose blood sugar was 157. So some people have very poorly controlled diabetes. And as such patients, when you show them this drawing and you tell them your HbA1c has come back is 140, and you hear them saying like, okay, I don't feel anyhow, so I'm not bothered. But this is more or less the story of diabetes. Now, how do we get HbA1c? You have red cells, and the hemoglobin in the red cells carries the blood sugar. The blood sugar is carried by the hemoglobin in the red cell. So the more sugar there is in the body, the more glucose is carried by the hemoglobin. And that's what the HbA1c is. The hemoglobin carrying sugar. The more there's hemoglobin, so the more glucose there is, the more glucose that is carried. So this diagram just shows how it works. Next slide, please. So the pancreas, you all know about the pancreas. It sits under the stomach. The pancreas is like the master organ of diabetes orchestra. Without the pancreas, there is no insulin. And without insulin, your blood sugar, like I mentioned, is not going to enter the cells. The cells will starve. As they say, somebody's living near a stream and using saliva to wash their hand. That's just what it is. You have glucose in the blood. Without insulin, that glucose, the cells are starving. And that's why people who have insulin-dependent diabetes, that is those like children or adults whose bodies no longer produce insulin. Many of them are slim because their body is breaking down itself. The glucose that exists, it can't use, so the body is breaking down the fat it has. And that's why most people who have type 1 diabetes are slim, while most people who have type 2 diabetes are obese. That's the difference, because in type 1 diabetes, you have glucose, but you can't use it because the insulin is not there. In type 2 diabetes, the insulin is there, but because the person is big, the body is resistant to the insulin. It's like putting your pin at ATM. You're trying to bring your money out, you keep getting the wrong pin. You try, money won't come out. That's just a way to describe insulin resistance. The insulin is there, but somehow you can't open the door to, and I mean, after a while, a bit of it goes in. So that is, next slide, please. I'll just mention briefly today being World Diabetes Day that there are, as of 2015, there are 415 million people in the world with diabetes. Next slide, please. And this is just a description of the numbers in various countries. But just to look at it, about 28% of people who have diabetes are over 65. About 0.2% are between ages 0 and 19. And most diabetic people, 72%, are in the working age. So when you imagine the working age people being diabetic, that can tell you the impact that would have, if that diabetes is not well controlled. Next slide, please. Now in the UK, about 1 in 14 of us have diabetes in the UK, 1 in 14. And about 1 million people have diabetes, but they're not even aware, they've not been diagnosed. Every 2 minutes, somebody becomes diabetic. And every week, about 185 people lose their legs from diabetes. And over 700 people die every week prematurely from diabetes. And the government spent about £10.2 billion managing diabetes-related problems. And it's so sad that more than half of all cases of diabetes can be prevented or delayed, more than half. Like I said, 72.9% are in the working age, and a lot of times diabetes is a lifestyle problem. The 0.2%, the children, that's what God has sent them to the world with. Their pancreas not working from birth. It's not their fault. But the vast majority of diabetes comes from our lifestyle. I mean, there's a saying that if your father was diabetic, your grandfather was diabetic, there's a big chance that you also will become diabetic. But if you change your lifestyle, mind what you eat, become more active and all that, you probably would delay the onset. Maybe rather than becoming diabetic at age 40, maybe you can become diabetic at age 70. But so it's preventable, or it can be delayed. Next slide. So to define diabetes, therefore, type 2 diabetes is a complex chronic condition that occurs when your blood glucose is too high. So that's the key thing. It's complex, it's chronic. You can imagine the blood sugar is too high, and then the blood goes around the whole body. So when that blood, imagine sugar, just high levels of sugar in your blood vessel, and that blood is going around the whole body. So what you now find is that if that blood sugar level doesn't come down over days, weeks, months, years, you begin to have problems. And those problems don't occur in just one organ. Those problems occur in different organs, from the head all the way to the feet. And that's why it's a complex condition, it's a chronic condition. Next slide, please. There are a few types of diabetes. I just want to concentrate on type 1 and type 2. I don't want to go into the others, but they are mentioned here. Type 1 is the one where the pancreas lacks insulin. That's commoner in children. A few adults have it, but most people who have type 1 diabetes, they have it at a younger age. And then there's type 2 diabetes, which is more in people who are older, 40 years and over. Unfortunately, you're not having younger people, teenagers, and people in their 20s coming down with type 2 diabetes, because of the terrible lifestyle. People spend the whole day on their phones, on their gadgets, very little exercise and all that. But then one more diabetes I want to mention is gestational diabetes, when women become diabetic because they are pregnant. So that after the pregnancy, their blood sugars come back to normal, although some of them in future become diabetic. But for some women, before getting pregnant, their blood sugars were fine. Pregnancy causes them to become diabetic. And even though many of them blood sugars normalize after they've delivered, some of them will have to check their HbA1c every year because along the line they could become diabetic. So again, not their fault, but because they brought a child to the world. So next slide looks at all the risk factors of diabetes. One is age. For type 2 diabetes, the older you are, the more likely you have type 2 diabetes. The one that you have as a young person, I've already talked about. The family history I also mentioned. If your parents are diabetic, like my elder brother had diabetes and was a pastor in Nigeria, had diabetes, and he was saying the usual, is not my portion, you need to get that, born again Christian and all the usual stuff, and then diabetes slowly destroyed his system. So he had diabetes, hypertension, kidney disease, and finally died from end-stage renal failure. I know he's in heaven because his faith was unshakable. Thank you very much. His faith was unshakable, and but he died because there's a difference between the body and the spirit. Even though God controls it, the spirit, the body is in your hands. It's up to you what you do with it. So if you destroy the body, you'll die. Yes, you'll die. So I just say a lot of us as Christians forget that God has given us the power to do the right thing. If you choose not to do right, you go to churches many times. I wonder, you come to a church, like in my church, there are many diabetics. When they're doing events, plenty of cakes, plenty of sugary foods. And they say, but then the people who are diabetic, the way they want queuing to go and eat the cakes and whatever, they say, where is the wisdom? You shall know the truth, and the truth shall set you free. So when you eat all the sweet foods, you bless the food, your blood sugar will go up. So ethnicity, those of us who are Africans and African Caribbeans tend to have more of diabetes, hypertension history, being overweight, being sedentary. Being sedentary, I think, is a big problem. Many of us don't do any exercise at all. Of late, I've been walking 90 minutes to 2 hours every night. I just walk because I realized that the kind of GP walk, we're sitting every day, morning till night. So many people don't do any exercise, but the more exercise we do, our blood sugars will come down. So even if you can come to church and sing and dance and jump for 1 hour, you sweat, that's good. If you can do it every night, fine. Do prayer walk, cast and bind, shake the body, fine. But you must do something. Do something. Honestly, we need to be more active. So people who smoke, and the people who have mental illnesses, unfortunately, many of the medicines we use to treat them make them to gain weight. And when people gain weight, they are more likely to become diabetic. And that's why people that have schizophrenia, depression, they tend to end up being diabetic because the condition stops you from wanting to eat the right food, stops from wanting to jog and do all the usual things to keep you healthier. And then on top of that, we now give medicines that make people have weight, unfortunately. Alcohol, too much alcohol can have an effect on the pancreas, can destroy the pancreas. And people who don't sleep well, poor sleep causes the body to become stressed. Stress hormones cause our bodies to retain fluid and make us gain weight sometimes. So all that can contribute. Next slide. So people from Black African, Caribbean, and South Asian background are at higher risk of developing type 2 diabetes from a younger age, from age 25 rather than age 40. Next slide. I mentioned being sedentary, working at the desk, sugar in the blood vessels. What happens is that too much sugar in the blood vessels irritates the blood vessels. Almost imagine that it's almost like bleach, concentrated bleach. What that will do to our skin is what too much sugar does to the walls of the blood vessels. So if you imagine that's the wall of the blood vessel, and the sugar irritates the wall of the blood vessel, and what happens next is that the body tries to repair the inflammation. What the body does is when the blood vessel is inflamed, it sends cholesterol, and that cholesterol, instead of repairing it, it sticks to the inflamed wall. And as more cholesterol sticks to the inflamed wall, the blood vessel becomes narrower. So the blood doesn't flow as freely as it should flow. So imagine the blood vessel becoming narrower. If it's a big blood vessel like the aorta, it's fine. But when that blood vessel becomes smaller and smaller as the blood flow, like you taking a tree, you have the tree, you have the stem, then the branch, then the smaller branch, then you get to the leaf. So imagine how it goes from big to medium to small to tiny. So when the blood vessels become narrowed, the tiniest blood vessels get blocked. When those tiny blood vessels are to the brain, or to the eye, or to the heart, or to the kidneys, or to the feet, or in men to the penis, blood flow reduces. So it is a reduction in blood flow because the blood vessels have become narrowed by disease caused by high sugar. It is that narrowing of blood that causes all the problems of diabetes. So imagine that the blood vessel to the heart, the coronary artery, becomes narrow. Blood doesn't flow well. If you do anything, you now have a heart attack. The blood vessels to the back of the eyes get narrow. And when they get narrow, they reduce blood vessel supply to the retina. You now have diabetic eye problem. And then people have issues with their strokes can occur because of the narrowing of the blood vessels to the brain. And the narrowing of the blood vessels to the kidneys causes kidney disease. That's why many people that have diabetes end up with kidney disease and kidney failure. And also hypertension, because when the kidneys are failing, the blood pressure rises. When the blood pressure rises, it damages the kidney more. So diabetes, kidney disease, and hypertension are like three musketeers. So the brain, the teeth, the eyes, the heart, the kidneys, and then the nerves. Again, the nerves require blood to feed well. When diabetes causes narrowing of the tiny blood vessels, the nerves don't get food well. And that's why people who have diabetes have funny burning sensation in their legs and things like that. And in addition, people now have a situation where you can have a wound and not realize it. You step on something, you don't realize it because the nerves are not working. It's pain that makes you take your foot away, and the pain sensation goes away, then you don't realize it. And that's why many people have a wound and they don't even realize it for quite some time. So everything boils down to the blood sugar being high. So next slide, physical activity is the best buy. Get active. There are so many reasons we need to be active, because the more active we are, the body is able to utilize the blood glucose better when we're active. And when we're active and we eat the right foods together, we can lose weight and help diabetes. Couch to 5K is an excellent app. It helps people to go from their couch doing nothing to being able to run 5 kilometers in 30 minutes. I've done Couch to 5K twice. It's an excellent app. So please, if you're inactive, download the app. You start it from running for 1 minute, walk for 1 minute, until after about 7 to 9 weeks, you'll be pleased with yourself that you can run for 30 minutes and do 5 kilometers. And when you do that, your blood sugars will come down. You'll feel the benefit. Next slide, please. This just tells you how much sugar is in different things that we eat. A Mars bar, the small Mars bar, has 1, 2, 3, 4, 5, 6, 7, 8. It's 9 cubes of sugar in one Mars bar. You can see how many cubes of sugar there are in 1 can of Coke. There are about 9 cubes of sugar in 1 can of Coke. So when you drink 2 cans of Coke in one day, I mean, look at the McDonald's drink. Almost 30 cubes of sugar in that. When you get your Big Mac and you have that Coke with it, just imagine how much sugar there is. So, and many people don't realize that. You just think you are eating something, but look at how much sugar there is. Next slide, please. Again, this just, let's say on an average, talking about our children now, we are feeding our children 75 grams of sugar every day, which is approximately 19 teaspoons. Now, this is 4 times above the guidelines that we're given, 4 times above. Next slide. So hidden sugar, again, even the foods that we think are good, look at the sugar in, even look at this drink, has 6 cubes of sugar, it's supposed to be a healthy looking drink. Next slide, please. I'm coming down now. So glycemic, we have foods that are high in sugar. That is, when you eat certain foods, the sugar levels rise very quickly. Other foods, it takes quite some time before the sugar level rises. So most of the foods we eat that are refined foods have too much sugar. So what I would suggest is look at the normal food that you eat in your house. Just go online and check. There are some websites, even check if it's Nigerian food, just Google Nigerian foods, carbohydrates in Nigerian foods, or calories in Nigerian foods. Just Google that. There are some Nigerian dietitians who have done some work. It's online. You can see the foods that you eat normally and see which ones, when you eat food, does the sugar level rise quickly or does it rise slowly and doesn't go that high? Any food that once you eat, like biscuits, cakes, the sugar levels go up straight away. That's bad for diabetes. If sugar level rises gently and not too high, that is better food. So what I will suggest is you do your own research. The foods that have high glycemic index, I'm not saying don't eat them at all, but eat them occasionally. The ones that have low glycemic index, eat them regularly. And then the last point on that slide is portion control. A lot of us as Africans, as wives, even I struggle with my wife because I come back home late sometimes and she looks at me, she feels my husband needs to eat very well. If I'm coming home at 8 p.m. or 9 p.m., what's the point? Nobody puts petrol in their car and then parks the car. You put petrol and you drive. So coming home late at night is not a good reason to eat heavy food because you're not going to need that food to sleep. So if you're going to eat heavy food, eat it in the morning and go and use it. But to come home at 9 p.m. and go and eat eba or pounded yam and, with 10 pieces of meat and then go and snore, it's of no use. So you're doing that, I know you're doing that because you care for us, but you're sending us to early grave. So if instead you want to give me pounded yam, make pounded yam for breakfast. So eat breakfast like a king and eat dinner as a pauper. And the reason is this, after you've eaten dinner, you're going to sleep. You don't need energy to sleep, you need energy for your day's job. All right, so the plate model, this is something that I want to recommend. It's American Diabetic Association's plate model. It's going to be challenging for us as Africans, but for every one of us here who is overweight, this plate model could make a huge difference to your life. Whatever plate you eat with, divide it into 2, and half of the plate should be vegetable. The whole purpose of that is that you reduce your calorie intake because vegetables are largely water anyway and it's a bit of starch, so you won't add much weight, and of course your body will not absorb too much vegetables. So whatever plate you want to use to eat in the house, divide it into 2 if it's possible, and let half of it be vegetable. And then the other half, divide it into 2. Make the white, whatever it is, rice, or whatever it is, let that be 1/4 of the plate and let the meat be 1/4 of the plate. What that will do is that you automatically reduce the calorie that you eat. So think about it. Whatever vegetable, whether it's or whatever vegetable it is, try and make it half of the plate. And then the other half, 1/4 for the carbohydrate, the other 1/4 for the protein. And if you're able to do that, honestly, your intake of calories will reduce, and that over time will help. So it will now be to creatively find what are the things that you can use to give you that calorie, that half of the plate. And if you put that half of the plate already vegetables, anyhow you put the gari or pounded or whatever, as long as it's 1/4 of the plate, you can manage to break that down. Just to re-emphasize this point, For those of us who are overweight, there's a so-called fridge freezer model. Imagine your kitchen. If your fridge is full of pots of food, stew, soup, full, you don't go into your freezer to defrost meat if the fridge has soup and stew. It's only when there is no stew or soup that you now go and defrost the meat in the freezer. And that's the way to describe our bodies. The fat in the body is your food in the freezer. The food we eat every day is the food in the fridge. If what you eat every day is enough to keep your body going, then there's never any requirement for you to go into the freezer to defrost. For us to lose weight, it means that what we eat has to be less than what we require, so that our body can go into the freezer, which is the fat, to defrost the fat. So the point then is that my life is sedentary. I get up, I call my patient in, I sit down, and I do that all day. There are some people who maybe they are going from one end to the other throughout the day, maybe 8 hours walk, they sit down for 30 minutes, 7.5 hours, they're up and about. Some people are carrying things throughout the day. That's fine. But if your work is sedentary, the energy you require is not much. Now, if the food you are eating every day is enough for the energy you require, then your body doesn't have any reason to go and take any fat and break it down. So for you to lose weight, what you are eating must be less than what your body requires. So to fill your tummy, then you require half of your plate to be vegetables, because the pounded yam and amala and all that is what will make the calories to go up. So by taking half of your plate as vegetables, you automatically reduce your calorie intake. Then your body can take some of the additional spare tire that we all have. So I think I have 3 more slides. 9+ processes, next slide. Good diabetes management is like, every year, anybody who has diabetes should have these things checked. Blood pressure has to be well checked. Next one is cholesterol. I mentioned that cholesterol sticks to the walls of the inflamed blood vessels. So the cholesterol needs to be 4 or less in a diabetic patient. And then I talked about, so most of the checks that we do, we are looking for complications. Retinal screening has to be done every year. It may not be available in some parts of the world, but in the UK, it's free for every diabetic patient. If you're not diabetic, you need to have an eye check twice every 2 years. Some people have been known to be diabetic because they went to do a routine eye check. When they looked at their eyes, they realized that they had changes. They said, go out to your GP to check your blood sugar, and they found out they are diabetic. So having your eye checked every 2 years is important. Then they check what is called urinary ACR. That's to check for proteins in the urine. Like I mentioned, diabetes causes damage to the kidneys. Seeing proteins in the urine, tiny amount of protein, is a very early change. Long before the kidney disease becomes obvious, we can see a tiny amount of protein in the urine can be the first sign that your kidney can become damaged years on. Again, early finding. EGFR is the kidney functions. The normal should be between 60 and 90. So doing a kidney function test helps. Every diabetic patient should have food checks by the podiatrist. There are very few podiatrists like in Nigeria, but at least here, every diabetic should have the HCA nurse or podiatrist checking their feet for just to be sure the sensation is right, and then they don't have any injuries on the feet. Weight check is important for obvious reasons. The lower your body weight is, the better you are for type 2 diabetic patient. Weight loss, honestly, I see patients who come and their diabetes, they just get a wake-up call when they become diabetic, and they make huge changes in their lifestyle. They come back to you, their blood sugar has improved. Maybe they've gone from 80 to 51. And you say, what have you done? They say, look, after I left you 6 months ago, I just changed my lifestyle. They've lost 5 kilograms, and you can see them, and I can say, look at the results. So weight loss is a fantastic thing. If you're overweight, don't wait until you're diabetic. Do something about it now. People who smoke, Of course, smoking damages the blood vessels. And for the men, we also say the same thing, that many men who have diabetes have erectile problems, and that's because the blood flow to that part of the body is reduced. And by improving the blood sugar levels, that can also improve. People who have diabetic for a long while, all the problems of diabetes, many people become depressed. So, like many chronic conditions, diabetes, hypertension, asthma, um, kidney disease, people that have long-term conditions tend to become depressed over time. So we need to check that people are not depressed. And then some on multiple medications, so we need to do a medication review. These are the processes that every diabetic patient needs to have. Next slide. I'll jump that slide. The next slide, choices. So the key point I made earlier, on the right you can see the walls of the blood vessels. The first one is normal. The next one you can see a bit of plaque, a bit more plaque, and by 4 you can see the blood vessel is so narrow that there's hardly any blood flowing through it, and that's where the problems come. So by the time we're age 20 something, you're already in number 2, particularly with the kind of foods that we eat in this part of the world. And that's where reduction of plaque buildup will come from making sure we eat the right foods. Next slide. We talked about this already. Next slide. In terms of, so the people living with diabetes, the lower the blood sugar is, the better. Next slide. This is the diabetic risk score. Again, I'll leave the presentation here. I would like everybody, if you're not diabetic, go on this or take a picture of it. Go and do a risk score for yourself, and I'm sure most of us on this side will realize that our score will be a bit on the higher side. So if you're not diabetic, do not wait to be diabetic. My people are still perishing for lack of knowledge, and you shall know the truth, and the truth shall set you free. Next slide. People have diabetes. There are 4 things that affect our lives. Our genes, we talked about, depending on what genes. We can't do anything about our genes. To do anything about our genes, we have to choose our parents carefully. The next one is our lifestyle. We have every control about our lifestyle. Next one is the health services. I mean, I am the diabetic lead for my practice, even though we have 5 GPs in my practice. Because I'm diabetic lead, those that I see would tend to perhaps have a better care of their diabetes, even though they're in the same practice. So who you see will sometimes determine how well, kind of, somebody who is diabetic in the UK may have a better diabetic care than somebody who's in Port Harcourt, where I'm from. So it all depends on the quality of health services and the environment we live in, our homes, where we live, where we are growing up, where we work. All those things have an impact. Because if you live in an estate which has lovely gardens or lovely places to walk around, you probably take walks normally every night. You live in an unsafe area and all that, probably won't. In some parts of Nigeria, if you take a walk, you won't come back home that day. So that kind of thing will stop people from being active. Last 2 slides. Next one talks about emerging technologies. There are various things that are happening in diabetes now. So instead of checking your blood sugar, you now have some sensors that you put on your arm. You just use your phone and scan, so you don't have to be pricking your finger anymore. And that has really made life easier for diabetic patients, that you don't have to be pricking their fingers. So we now have insulin devices that you wear automatically to check your blood sugar and then change how much insulin is getting into your system. So quite a few new technologies that are making life easier in diabetes. There are smart contact lens. People wear contact lens that will let your system know how your blood sugar is doing. So you don't even need to phone the contact lens to communicate with the server somewhere and say Hector's blood sugar has gone up. Or I've eaten my anniversary meal and then my blood sugar goes up. I say, oh dear, I need to do something else. So it makes life a lot easier. Honestly, I have 2 final slides now. These are all the ways diabetes affects the arteries and veins. So on this side, diabetes can make people depressed, can cause a stroke, and can affect their mood. So we check their mood, and then the eye disease, we check the retinal screening, the blood pressure, the heart can be affected. The thyroid can be affected sometimes. The heart can cause heart failure, can cause a heart attack, myocardial infarction. And then the kidneys can be affected by diabetes, so we check the kidney function and do the urine check. And then also check the cholesterol. Women can have thrush, men can have poor erection, or both sexes can have water infections. So we check HbA1c, smoking, exercise, dietary advice can affect the senses in our legs or reduce blood flow to the legs and cause food ulcer. So we do a food check. So these are the reasons why we do what we do, as because you can see diabetes affects everywhere from the brain to the feet. All said and done, final slide. Your health is in your hands. Thank you. Listen to me. At the end of the day, what you do with what I've said is up to you. I will not take Panadol for your headache, and your life is in your hands. May God bless you all in Jesus' name. Amen.